Woman, an in-depth exploration of the world of women today with Sandra Elkin.
Good evening and welcome to Woman. The question we're going to consider on tonight's show is why some women are dissatisfied with their gynecologists. My guests this evening are Ellen Frankfort, who is a health columnist for the Village Voice and the author of Vaginal Politics, and Barbara Seaman, who has written Free and Female and The Doctor's Case Against the Pill. Welcome.
Thank you.
I have to tell you, I conducted my own private poll in preparation for the show, and I talked to lots of women, and I asked them about their gynecologists. Are you satisfied? What do you feel? And the answer I got, 100%, was, I love my gynecologist.
Well, that makes sense on one level. I think if we didn't love them, we wouldn't submit to all that surgery and the pills they give us. But on a more serious vein, I think there's actually an explanation for women who say they love their gynecologist. How else can you resolve the psychological dilemma of having a stranger deal in so intimate a way with our body without in some way developing some kind of romantic feeling? So I think you either love your gynecologist, and you see this among older women who've just had hysterectomies, and they spend hours setting their hair for the few minutes the gynecologist is going to take when he comes along on his rounds. It's really sort of pathetic, and yet I think this is not an unusual thing. I think it's changing with younger women, though, who have a very different attitude. I haven't done my own poll, but I think it's different.
I would agree with Ellen that there is a temptation to invest them with more good qualities than they may really have. When you're up there on the table, it's a very humiliating position. And also, many women have such loathsome feelings about their own bodies that they feel grateful. And they assume that it's an unpleasant thing, and that if he's the least bit nice, that he's really being terrific to them. I would like to add that it may be that the particular women that you asked really do have wonderful gynecologists. I would say that in gynecology, as in most medical specialties, my impression is that about 15% of the doctors are first-rate, conscientious, they really keep up, they really relate to their patients as human beings. And another 15% at the bottom are really bad, irresponsible, sometimes unethical, lazy, don't keep up. And then there's that vast middle range.
I don't know. I really think, Barbara, that it falls more into two categories rather than, you know, that nice bell curve of some good, some bad, and then the middle are just so-so. That there are the kibitzes who really pay a lot of attention. They've learned a manner that they think women like, and many women have learned this manner as women, and so they like it when a doctor flirts, so-called, and says, honey, and will you come back, dear, and gives them a little pat. And women think this is attention. It's just the whole psychology of feeling grateful for any attention a man will give you, particularly I think when you're in that very humiliated position of having to drape yourself, which just emphasizes the shame so many of us were brought up to feel about our bodies anyhow, and particularly looking at that section. A friend of mine was just in a medical examination. The nurse said, will you please wash your hoozy-watsies? My friend said, my what? Trying to get the nurse to say the word. The nurse, who's seen lots of hoozy-watsies, could not mouth any word having to do with the genitals. And I don't think this is uncommon even with doctors.
What are some of the most common complaints that women have about their gynecologists?
That
the media has been flooded recently with articles.
Okay, the complaints that I hear most frequently are great contemptuousness about the woman's time, so that they schedule patients
sitting in the
a way
office for 3 hours waiting for
doctors in specialties where they treat males assume that the men are more busy, and they're much less apt to schedule patients in such a kind of authoritarian and autocratic way. Not answering questions, very common complaint, and particularly now as women are becoming aware that a lot of drugs that have been promoted as very safe and simple have dangerous side effects, that surgery isn't fun, and so on. They want very concrete answers to many of their questions, or many women do. Some women prefer to let the doctor do the worrying for them. And very few gynecologists are really trained or apt to think in terms of really giving patients full explanations of things. Then there's this whole humiliating treatment of being stuck up there with your legs in the stirrups and left there to wait.
I don't know why they don't put the reading material in that room. That's where you have the longest wait, and it's usually cold. But
it's cold, and sometimes they leave the door open. There's often a kind of an impersonality, or else too much personality and too much personal stuff. I loathe it if a doctor calls me sweetie pie. And also, I've noticed that many doctors expect me to call them Dr. So-and-so, whereas they call me Barbara or sweetie pie. And that is not treating somebody like an equal, and it's not treating them with respect.
And I think along the lines you've been talking about, the feeling not only that doctors don't answer questions, but that you're imposing on the doctor's time if you dare ask any, particularly any that don't relate to specifically that genital area that you really are to a gynecologist. So you wouldn't think of asking a gynecologist about an earache. You're just so fragmented. You're just that one part. And it's also just a very bad way of thinking about our bodies, a very unhealthy way to not connect up all the parts with one another, because in fact they are. But I think that goes along with the whole lack of preventive medicine, and that gynecologists don't tell us how to eat, even though that's probably affecting our gynecological health. And I think the other thing is also money.
They don't even like it if we treat our own vaginal infections with a little yogurt.
Right. I mean, or anything by ourselves, unless it's something they don't want to do and they can't make profit from. I mean, gynecologists, the routine work that nurses do, they're not interested in if it's either boring or unprofitable. And most routine preventive care is so-called boring if you don't take the person into account, if you don't take the feelings into account. And I think the other real complaint is, and probably the most common one, that is not the ones that the health activists have been talking about, is the cost. Even any woman, average woman who hasn't read these books and hasn't been part of the movement, so-called, still I think resents the cost of having to pay $25 to cure an itch. Many just go
in New York
around.
City, they charge $50 and $75 to put in an IUD, which they spend about 2 minutes doing. Most of them don't even take the time to use a little local anesthesia first, which would make it a lot less painful. They lie to the patients about how it's not going to hurt, and then very often it's excruciating. They go through the ceiling.
I wasn't aware that there were even some doctors doing that.
The IUD itself is worth a few cents. I mean, it's just unconscionable that this little piece of plastic or whatever it is, and 5 minutes of the doctor's time.
I mean, the other thing, just an illustration, I think, of a small thing in which the gynecologist does not consider the comfort of the patient but his own, that many women mention, is how cold the metal speculum feels.
Yes.
And when it goes in, it sort of feels like a shock to the body. And it's very simple to warm that, but the only reason doctors don't, I mean, you can just keep a heating pad below the table. New examining tables actually have them built in. It's because it takes up more time. Now, why don't the doctors take up more time? Because they can see fewer patients. And just the feeling that you're part of a factory, and whether it's an infection or anything, that you're to be, you come in and go out as quickly as possible. And that certainly discourages asking questions about our health. And since the gynecologist is a doctor that deals with our sexual anatomy, it doesn't make it very conducive to speak freely about any questions we may have. And then if we do want to, the assumptions of most gynecologists are so conventional that it makes it very hard for women who don't fit into the conventional lifestyles of doctors to. This is a very common complaint among younger women.
There's another factor that has been mentioned often in complaints that I've heard from women about their gynecologists that we haven't brought up. The gynecologists are trained to think of women as having a lot of psychosomatic problems. They have a sort of it's all in your pretty little head attitude. Many of them. I mean, again, of course I'm not speaking of all of them. And you can see this in their medical school textbooks.
Let's talk about the training and how much you
for
think is
example, one of the
responsible.
most widely used textbooks, a textbook by Dr. Wilson at the University of Michigan, says the traits that compose the core of the female personality are feminine narcissism, masochism, and passivity. So even if the medical student starts out as a nice kid, he's likely to be a screwed up sexist by the time he finishes memorizing passages like that. Then the drug company advertising, which shows women with all these psychosomatic complaints. So if a woman is, for example, taking the birth control pill and is having symptoms, and she comes in to see her gynecologist, over and over, women have reported to me that they feel as though they were up against a stone wall, that the gynecologist makes them feel as though it must be all in their heads. And the term hysteria comes from the Greek word for uterus. Men have always assumed that somehow, because we have uteri or uteruses, that we're more emotional than they are, and not to be taken seriously.
Is there anything positive, though,
But,
about the medical
it's
school
a-
training? I mean,
well, it's funny because this thing of assuming we're too hysterical as almost everything with women's health issues, it has two sides. We're both so hysterical that we have to be knocked out or overly sedated. I mean, or the other side, we're treated like corpses. And I was telling you earlier that I think one factor in explaining why doctors treat all patients, including male patients, as if they're little more than living corpses is because they're introduced to the human body via the cadaver. And for an entire year, they work on something that is cold and inert and cannot respond. I think that's a very profound experience that's hard to undo. Now, I would say, in addition to studying anatomy via the corpse, I'm not advocating we should cut up live people, medical students could be introduced to real patients at the same time. So it isn't 1 year of something that can never respond. I think everyone's seen, who's been in a hospital, has seen doctors standing around, having a conference among themselves within a few feet of a patient's bed, talking as if the patient cannot hear. There's something really bizarre about that until you think back to that whole year of working on a cadaver.
why don't men complain more about health care? I mean, you know, something
Well,
you just said was very
they
general.
do,
I mean,
by
it's
the
also
way, but I think that they don't use the health system as much as we do. So that's the first most obvious reason, that a healthy male of 40 has had very few routine experiences with the doctor, whereas a healthy woman of 40 has been poked and probed and palpated so many times. And then if you take into account the pediatric visits, the percentage which uses the doctor is so much greater than that of the man that I think we just have so much more contact that we are, you know, we are the health consumers up to a certain age.
If I could just get back to your last question for one moment about medical school training.
Yeah.
I really think that every male doctor who wants to go in gynecology should be required to get up on a table and put his legs in the stirrups and have somebody poke a cold speculum into his, what did she call it? Woozy Watts?
Woozy Watts.
They really, many of them have no sense at all of how humiliating and unpleasant the experience is.
I know some doctors who've actually done that.
Who've tried it
Yeah.
out.
They're
And
probably
it's
one of the
terrific.
nice ones.
I think
Yes.
there is a change, certainly among younger medical students and even some of the other doctors. They're trying very hard, and I think the women's health movement has made an impact, and doctors are beginning to wonder what they can do to make things better, and some are warming the speculum. One thing I think we have to be a little bit wary of are the hip young doctors who think, well, we'll just take a very detailed sexual history. This is what they want, that's women. And that's not what better health care is. I resent that unless it's something I feel like talking to. I mean, my idea of improved gynecological service is not, you know, someone to do a health sexual survey on me unless I feel like talking about that. I'd much prefer to have routine care before that, or have that as my choice. But there are a lot of doctors, I think, who equate that with women's demands in gynecology. I don't know, Barbara, if you have any feelings. You're really
Well,
the
it was you
expert
who
on
told me
it.
this story about a rather admired gynecologist in New York who has this fantasy of setting up a sex clinic where he can teach women how to masturbate.
Yes.
And that is a lot of the ones who were, beware of the ones that seem young and hip.
Yeah.
Give me a nice, old, conservative,
Do you have gynecologists?
gentleman or woman.
Barbara, do you go to a
Oh,
gynecologist?
no. No, I go to an internist, and I'd like to tell your viewers that many women go to a gynecologist as their main doctor because they think that the gynecologist is the only one that can do a pelvic and pap smear and a checkup in that area. And it's not true. A great many internists are willing to do it, and they're perfectly competent to do it. Now, then if the internist finds some special condition that needs further attention, he sends me to a gynecologist, but I want the internist looking over the gynecologist's shoulder, and I want the internist to be my main doctor and the gynecologist just to be a consultant, because internists are trained as the traditional guardians against unnecessary surgery, and they think of surgery as a last resort, whereas gynecologists are trained as surgeons, and like generals who are trained to fight and want to fight, the gynecologists are trained to operate and they want to operate. And it's really quite scandalous, I think, how many unnecessary surgical operations are performed on women in this
Do you
country.
recall the figures on hysterectomy?
According to a study done by Nader in cooperation with doctors in a hospital who supplied him with the figures without their revealing their own names to protect their jobs, it was a conservative estimate that 1/3 of all hysterectomies performed in the hospitals they studied were totally unnecessary, and then there was a fairly large percentage that were questionable. There was some pathology, and it was a real question whether they should be performed. But 1/3, which were definitely unnecessary. I'd hate to think of how many unnecessary D&Cs are performed, because that seems to be something that a gynecologist will say to have done if you have any complaint that the gynecologist can't explain. And I can confirm Barbara's advice about or experience with gynecologists operating. I mean, I've tried to liberate myself from my gynecologist after
Do
reading.
you have a gynecologist?
No, I have had a gynecologist, and I have had a lot of operations. And I had one very good gynecologist who advised me not to have operations that others did, and I feel I should mention his name even though he's retired, because I think one of the things we should start doing in medicine is name names. His name is Gray Twomley. We're so accustomed to protecting doctors that even when we want to say I had this terrible experience, we still don't mention the name of the doctor. And yet I think it would be very useful if we could get a directory of good doctors and bad doctors. It's very hard to know how to judge.
One of the things that's so inexcusable, and which we in the women's health movement are trying to counter, is that there's this old school tie feeling about protecting their colleagues, so that all the doctors in a community know who the incompetent ones are, and they also know who the unethical ones are. And yet they cover up. And they still assume, and women are still told, call your county medical society. As long as he's licensed, he must be kosher, and
Wait a minute, but that's another area.
anyhow, in New York City, at one of the women's health groups that Ellen and I have both been involved in, we've been doing a health watch where we collect women's reports on their gynecologists. And there were several reports from different women about a gynecologist who was doing something very bad. It may have been performing clitoral massage on some of was making sexual advances. And so whenever doctors have said to me, oh, how's your health watch coming? And I've mentioned that, well, we've discovered a few doctors who seem to be making sexual advances, they always know who they are. I mean, every doctor in New York City because but they don't turn them in.
It's another thing that's come out of this, which is interesting and shows that there is a real influence, I think, is that there was one doctor that consistently was described as just being different from any other gynecologist. His name is Ed Stim, and enough women reported this so that finally when a woman's clinic was looking for a director, they approached this Ed Stim, who just had a little shabby office in the Bronx, and he's now a new director. I mean, because so many women independently had written such good things. Not he's great, not he's marvelous, not he's a god, but it's just a different kind of experience. He explains everything, and he is quite an unusual person. The other thing I want to mention, just along these consumer lines of where we don't mention names and doctors protect one another, is when you start to think about it in any detail, it sort of becomes shocking. I mean, the fact that we pay for x-rays and yet we don't own them. If that were true of any other product that we had purchased, we would make a big fuss if we didn't didn't own it. And the other examples, I think, that make the point of how little we question established ways in medicine are, for instance, if we went to a lawyer who said, sure, he'll write up a contract, but it will be in Latin, we would think it very odd, and yet we don't question that with prescriptions. And my third is, if we went to, say, an architect who said he'd draw up a plan for a house but wouldn't show it to us, we would certainly think something odd, and yet we don't question the fact we can't see our medical
Is it
records.
because we don't see ourselves as consumers?
I think we don't see ourselves as consumers. I think there's a lot of fear. This is getting back to Barbara's earlier point about the body as mysterious, dark, particularly the woozy-watsy area, and a great reluctance, because we've been trained to be very fearful, and the body's been mystified, the doctor's been mystified. It started at a very early age when we were 5 or early. I still recall my first experiences with a doctor and being bribed with lollipops and things like that. And so I think the doctor has such an early psychological start. I mean, all professionals have a mystique, teachers and lawyers and whatnot, but we don't deal with lawyers when we're 5 years old. So children develop at a very early age certain distinct feelings about doctors. And then it's very easy to work on these feelings, and it's very much to the doctor's advantage to be mystified. Aside from giving him a sense of power, he can then charge prices, and we don't question, because we think what he does is just so difficult to do, and is dealing with such a mysterious thing. Once we start to learn a little bit about it, we realize it isn't that all difficult, and we start to question then all these other areas, including why he charges so much.
You mentioned in your book one incident where you looked under a microscope.
Yes.
Do you want to talk about
It
that?
was sort of interesting. I was just lying on the table, and the doctor had taken his smear. I had symptoms of an infection, and rather than lie there in that state of terror, which I think ignorance creates, the microscope was right there, and I asked if I could look under the microscope and see. It was really an eye-opening experience just to see those little things, swimming about that came from my body. It was interesting because, for one, I could see what the doctor's looking at. I could see what process is involved when you put a slide underneath and what had happened. And then I realized it wasn't that difficult to do, that one could be trained to do that. And that then I started to question, well, how come $35, this all takes 5 minutes, another $10 for flagell, $10.50 or whatever. You start to add it up, and one begins to question the whole thing. But it demystified what he was doing. It demystified my body somewhat. And it also made me feel less passive, than just lying there feeling frightened.
Let's talk about some practical things
Incidentally,
before we run out of time.
We have found in the women's health movement that as women take courses in their bodies and get to feel at home in them, they feel more at home in the world. It's just, and often their sex lives improve too. That's another
Fringe benefit.
How much more can you promise?
what could be better?
What are some questions that a woman should ask her gynecologist, and what's a criteria?
Well, I think one of the things that we should, a general rule is that we should realize that the gynecologist has been taught about our bodies in general, even though he doesn't behave that way. So if we have cramps in our legs and we're on the birth control pill, it's quite important to mention, or we notice some kind of funny clotting that's not related to the genital area, we should still bring it up. And yet I think many women may hesitate. Another interesting thing that came out of a survey a group of women, lay women, did on gynecological services in New York was they found that the part of the examination most frequently omitted is the breast examination, unless, if you go in for an infection or an IUD or something, rather than a thorough examination. A doctor will not automatically examine the breast, and yet that's quite important.
Was that the thing called how to get through the
Yes,
maze with your feet in the stirrups?
How to get through the gynecological maze with your feet in the stirrups. They went through the gynecological mazes of New York and produced a very useful little directory. This is the Women's Health and Abortion Project of New York that then became the Women's Health Organizing Project that Barbara and I have been associated with.
Barbara, what about the public image of drugs?
I think the public image until recently in this country was that if 1 pill is good, 2 pills are twice as good, and 3 pills are 3 times as good. But I think Americans are gradually becoming aware that these modern pharmaceuticals are very powerful and should not be taken lightly. in the city of Boston, Ellen may know more about this than I do, they monitored all hospital admissions during a certain period, and they found out that something like 5% or 8% of all hospital admissions were due to reactions to a prescription drug. There are more people going to the hospital with reactions to prescription drugs than getting sick from pot and stuff like that, if the truth be told. Then also they found that among patients who were already in the hospitals, a very high percentage had their stay prolonged because of a reaction to a drug or a drug given in the hospital. It was very scary, and I think that among people who are fairly knowledgeable about health, there's been a great backing away from drugs recently. Perhaps
Should
I'm
a
wrong.
woman ask for the spec sheet on a drug, or?
I would. I would never
I think
take
we
a drug
should
without
start.
looking
We
it up.
should start having physicians' desk references as we have a dictionary. They're not impossible to read. We've just been led to believe they are, and we should check out everything. We're not told the contraindications of drugs that were given very readily by doctors. We just accept them, and it's just frightening when you start to look at them and the cautions. I mean, just most recently I came across a booklet on estrogen replacement therapy, and at the very back were the list of contraindications, and yet the booklet, which was in very insulting style to women cartoons, it showed a woman in front of ovary manufacturing company, the shade pulled down, it said closed forever with a big padlock on the door. And of course the whole answer was she wouldn't experience madness or masculinity, even though women were shown with beards and razors near their chins.
Oh yes, look what
If,
David Rubin says in his big best-selling sex book.
Tell us what David Rubin says.
He says,
hate to give the man more publicity, but he's had some.
What
much
I-
won't matter.
he says that as you reach menopause, you turn into, he says the hair on your head, you start to get bald, you start to grow hair on your face, your breasts and your vagina shrivel. All this is happening because your estrogen is shut off. And then he says no longer
Clothes
a
forever.
woman, but not strictly a man either. You inhabit the tragic world of intersex.
On that note,
Oh, on so tragic a note.
I want to thank you very much for being here. Good night. See you again next week.